So I'll be brave if you're brave. I'll be brave, but only if you're brave.
Welcome to those of you who are able to join us today during our Lung Cancer Living Room. For those of you who may not know me, I'm Danielle Hicks, Chief Patient Officer here at GO2 Foundation for Lung Cancer. Tonight's topic, as you may have already seen, is get to know the GO2 team, who we are and what we do. This evening's conversation is not meant to be an exhaustive list of the work each department does. That would take way longer than an hour, but rather meant to be a peek into some of our overarching programs and how the work we are doing impacts our lung cancer community. A lot of people that interact with GO2 do so in a singular way. For example, through our policy work and our Voices Summit, or through one of our support and education programs. But those single touch points don't allow people to necessarily have the benefit of fully understanding in a comprehensive way all the spokes in the wheel that make up all of the work that GO2 does. We hear, I didn't know you did that, more often than we'd like. So we thought that we would kick off 2023 by gathering team members from the different departments to take a deeper dive into the who and the what makes up GO2 for lung cancer. We believe we have a powerful story to tell, and tonight we hope to tell it. Tonight's speakers represent different departments within GO2, and you'll be hearing from Lori Fenton Ambrose, our co-founder, president, and CEO, Jennifer King, our chief scientific officer, Joelle Fati, who's our chief healthcare delivery officer, Maureen Rigney, senior director of support initiatives, Elridge Proctor, senior director, government affairs and public policy, Anita McLaughlin, senior director of economics and health policy, and bringing up the rear, but never in the rear, Jennifer Hughes, senior director of national events. Before we begin, I'd like to ask our president and CEO, Lori Fenton Ambrose, to open our meeting and talk a little bit about GO2 for lung cancer, where we are and where we're going.
Oh, Danielle, thank you so much. And to you who guide these conversations each month in just such a high touch, personal, and informative way, you just do an amazing job for the community. So thank you. And thank you for gathering this team together, and for all of you listening. There are many more of us that are there to work every day to support you and your needs wherever you may be in your journey. And I've never been with a more passionate, compassionate, and knowledgeable and can-do group than the GO2 team, and thrilled we could share a little bit about kind of our vision and where we're going and what our laser-like focus is. The bottom line is that we've been around focusing like a laser on transforming survivorship. That's what this is all about. How we can save lives, improve quality of life, make sure people feel more connected to one another, and that we are building a community both locally and globally to confront this disease. That's what this is really all about. And we wake up every day thinking about you as our community and how we can serve you best and provide you the needs that you need at whatever moment that could be. So we're about doubling down on survivorship and transforming what this means. We've had 4 key goals guiding that over these years. And for everyone listening, we know first and foremost, it's about doing all we can to find this disease as early as possible when we know it is manageable, more treatable, and frankly, curable. So the more lung cancers we find early, the better off our community will be. But in that process, we also want to make sure that the right treatments at the right time are what you as patients are guided to. And that is this whole evolution of personalized medicine that we've heard so much about, and how we are really trying to individualize care, because frankly, we all are our own individuals and are on a unique path that should be addressed in that unique way. So we want to make sure everyone is tested, and what we find through those biomarker tests will help best guide the treatment pathway forward. In that process, of course, will create survivors. And survivors mean voices, and voices mean activation. And that's how we can link everyone together and build a stronger community that, frankly, can galvanize national awareness and tension. You'll hear more about this, but it's how we can really better shape healthcare delivery systems. It's also how we can increase that valuable research that is the scientific engine that drives life-saving breakthroughs. And in that process, of course, it's all about just having a quality of life that allows us to be there for family, for friends, and to be able to give back and support one another as we can. So, our work is about finding lung cancer early, making sure everyone is navigated through comprehensive genomic testing to the right treatments. In that process, connecting you with others that are there in a hopeful and supportive community, and then ensuring that your quality of life is sustained as long and forever as possible. And we've got an amazing team that's come together to think about just that, almost like a continuum. And that is, in essence, a continuum of care that we think about every day and in every way. So we think of ourselves as teachers, as guides, as advocates, as supporters, and we just confront this disease together to transform survivorship. So Danielle is such an awesome moderator. And as I told her, I could talk all evening, all night, all the next day, and she's got to give me the hook and say, okay, Lori, time for others to chime in. But I so look forward to the conversation that will flow so that you know all that we have as programs and focuses to be there at your side every step of the way. So Danielle, let me turn this back to you and guide this conversation to flow tonight and the days ahead.
Thank you so much, Lori. That was beautifully said and stated. We are doing a lot, as you will see. The lucky winner to go first is our very own Jennifer King in science and research. Can you tell us a little bit about yourself, your team, maybe give us some examples of some of the work that you're doing?
Sure, absolutely. And in introducing kind of who my whole team is, I think the examples will come out. To start, hi everyone, I'm Jennifer King. I'm our Chief Scientific Officer. I've been with GO2 about 8 years now, and I have the joy of overseeing the whole Science and Research Division, which we get a lot of questions about. I would say that's one of the areas that people don't always understand what we do, because a lot of nonprofit entities give out research funding to investigators at different institutions. We do a little bit of that, but even more, we do collaborative research, large projects where we're really providing staff support, scientific expertise, and infrastructure to our research community, whether it be academic researchers, researchers in the community, or even pharmaceutical biotech diagnostic partners. We're helping provide those resources and support to do large scale projects that can really make a difference for patients. We like to incorporate patient and caregiver voice in everything we do. So I have a big team who I will introduce, kind of starting with Andrew Kupek, who many people know. He's been on the living room before, and he's supported by Brittany Nichols. They work in what we talk about as our clinical research division. So they're really looking at how do they take a study from an investigator and find sites within the community, often within our centers of excellence that Joelle will talk more about later in excellence in healthcare delivery. But how do they take a study and really find the right places for it to open to make sure it's reaching the right people? So there's a lot of examples of that. A major one is the clinical trial we did on smoking cessation at the time of lung cancer screening and how to optimize that with investigators at Memorial Sloan Kettering and NYU. That opened within 18 sites in our centers of excellence network. And so they're really thinking about taking true studies, often academic driven studies, and bringing them to community partners where we know many people are being seen. And that's not just in lung cancer screening, it's in many different things. They're doing a COVID and lung cancer study, looking at some studies in providing immunotherapy to Black Americans who may not have gotten it in the original clinical trials, many different types of studies within that group. They also work very closely with our Medical Research Institute, ALCMI, who I want to give a shout out to today. While they're technically a separate entity, they're really a part of the science and research team. And led by Richard Irwin, ALCMI really is the engine that's able to execute clinical research studies when GO2 is interested in doing one. So they're the sponsor, they're really the hands-on clinical operations expertise that we can take advantage of to execute really interesting studies. One of those in the precision medicine space that's open and enrolling now is our new SPARK trial, which is looking at resistance to the new generation of KRAS G12C drugs, both Lumakras or sotorasib and Krazati or adagrasib. Patients who are experiencing resistance can actually, through that study, give blood anywhere in the United States, anywhere they are at home, and then they get reports to understand how their cancer has developed resistance to those new drugs, and the scientific community gets that understanding. So, like I said, we're trying with everything to make sure that all our studies reach patients easily, with the most patient input possible, and that we're also advancing new, innovative, exciting science. One newer area for us that we're really excited about is community engaged research. Shanada Mazstein was on the living room in November talking a lot about health equity, and that is the area that we're doing a lot of work in health equity. The essence of community engaged research is going into a community and really having them help develop the research studies and what needs to happen. And that's something that we're doing more and more in a lot of our local, on the ground health equity work, as well as developing research that these communities need. So that's a big area that we're continuing to expand on in the future. And we have some studies, Ready Lung and other things that will be happening this year in that area. You may have also in the living room before heard about the lung cancer registry. Heather Law now leads the lung cancer registry team. The registry is a great resource for understanding what patients and their loved ones are saying about their lung cancer journey all the way across the care continuum, anywhere from their experiences getting screened, getting diagnosed, biomarker testing, treatment, all the way through into survivorship. We have 2 different research studies that are currently written as manuscripts and out for review that should be published soon. One on sexual health data that described at World Lung this summer that's brand new, an area no one had ever really studied before, in collaboration with Dr. Flores, to really look at what treatment for lung cancer, how it impacts women's sexual health. A question no one has asked in this community before. And then another one that's follow-on work Maureen and I published a few years back about stigma. And this is data right out of our lung cancer registry on how people are perceiving lung cancer stigma and whether certain demographic factors, particularly a history of smoking, makes a difference in how that stigma is perceived. So learning right from our community. The other study I want to flag there is caregiver study. We call it caregivers, but really it's any loved one of anyone with lung cancer can join the registry and talk about their expertise, answer questions that's really going to help us design support services for loved ones. Heather has John Wells on her team who stays behind the scenes doing a lot of project management and is bringing on a new coordinator who people hopefully will be meeting very soon. And then LungMATCH is the last one now with Renee Botello. The LungMATCH team really is a cross between patient and caregiver services and science, in that it is our treatment and trial navigation service. They are experts in lung cancer science, what's happening in the clinical trial space, what biomarker testing should look like, how to interpret your report, and they're really bringing that science directly to patients. You can call our helpline talk about getting a consultation with the LungMATCH team, and they will really talk through with you what treatments could be right for you, what to ask your treatment team, how to find the best therapy, if a clinical trial might be right, and what clinical trials might be best for you in that space. I'll also flag the our Nuestra Gente initiative, which is launching very soon with a lot more Spanish speaking resources brought to you in very culturally appropriate ways. We do a lot of things. We study a lot of areas across all our 4 key goals in the care continuum and work very closely with all of my other colleagues on the call.
Thank you, Jennifer. That was fantastic overview of a ton of work that is going on there. And I just want to, I'd love to recap everything you talked about, but I really do kind of want to go back to the registry and how much we value input from the patients. So the questions that we are asking is for really none other reason than for us to identify areas where there are challenges, identify where there might be gaps, so that the experience for you and or those to come after you won't be as challenging.
We greatly appreciate everyone's participation in all the studies, including the registry.
Yeah, and I think you're going to hear this theme sort of throughout as these folks continue to talk. I mean, we are here for the person at risk or diagnosed with lung cancer. So we don't take a step or make a decision without first talking to you and gathering that input and that information, and then developing and creating these programmatic areas across the departments that we believe, based on that input, will have the greatest impact on your care. So with that, I am going to turn to our next up, which is Maureen Rigney. As Jennifer had stated, there's a lot of cross-pollination work. We work very closely with science and research, not just on and with LungMATCH, like you said, but and or recruitment for the registry or any of these trials, but also on all of our publications. We rely on their expertise to ensure that the information that we're giving you is accurate, correct, and up to date. So with that, I'm going to turn to Maureen with the very same sort of, high level question about work that patient support service is doing. Tell us a little bit about yourself and the team, our team that's doing the work.
Absolutely. Thank you so much, Danielle. And first, I have to start off by saying I speak for everyone. We really treasure you as heading up patient support services. So thank you for your vision and your direction. I am Maureen Rigney. I am a social worker and I am Senior Director of Support Initiatives. I've been with the organization since 2004, so I've had a lot of different responsibilities and worn a lot of different hats. But I've been back with PSS for about a year and a half, and I get to also work with Jennifer on some research. And primarily now in PSS, I oversee the HelpLine with the help of others. So it's really an honor to be able to present our dedicated team. And I'm just going to introduce them by name first, and then you'll learn a little bit more about them as I go. Many of you have interacted with them. So we have Michelle Zay, who is behind the scenes right now, coordinating the living room. She is our manager of patient and support services. We have Miranda Goff, who is senior manager of support services. Amy Kampschroeder, who is manager of patient outreach and special initiatives. And last but not least, Nicole Phipps, who is Senior Director of Patient and Support Services. So because our programs and services are so focused on people at risk and living with lung cancer and their loved ones, we're often the front door into the organization. There have been a lot of advancements in lung cancer, and there's more hope now than ever before. Unfortunately, more advances only makes a really confusing disease even more confusing. And so we in patient and support services really see our role as trying to kind of help clear the fog, help people understand the disease, and realize that they're not alone. And for simplicity, I'm going to talk about our services in 3 ways. So first, there's education and information. And so we know that knowledge is power. And so we help people across the disease spectrum understand the disease and then find their best care, whatever that might be. So we talk to people who are worried about risk, who are looking for screening, people who are going through the diagnostic process, people who have nodules that are being managed, people who have been diagnosed and want to know what their treatment options are. And then, of course, through all aspects of survivorship with an emphasis on really hope and quality of life along all of that. So Jennifer mentioned the LungMATCH navigators. And so, having been here so long, I have seen so much change in lung cancer treatments. And so, we're really fortunate that when people need very, very in depth discussions around their treatment options and are curious about clinical trials, that we have the LungMATCH team to refer to. We are really the kind of the front door for that program as well. It is really important that people get their care at the best quality they can, and so we help people understand where to go for their care, for screening, and for second opinions. So we try to get ourselves out there and help people in ways that are the most comfortable for them. So we have our toll-free information line, the HelpLine. We also get emails from people, and then there are web tickets on our website. So people can contact us in many different ways. Likewise, when they need, information about the disease beyond just talking, we send links through emails. We have packets of information that we can send to them. And we have Amy Camp Schroeder, who is a certified health education specialist, and she's really helping us to make sure that our materials are the most as reader friendly as possible. And obviously, we have the Lung Cancer Living Room, which is a really powerful way to connect people in our community with experts across such a wide variety of topics. And as I said, Michelle coordinates that. And the great thing is that if you miss a living room or there's a topic that you really loved, you'd like to see again, we have a library of archived living room sessions. So that's really amazing. So the second we really focus a lot on is support and connection, because there's a lot more to lung cancer than just the treatments. There's often an emotional roller coaster. People need help coping. People may be subjected to stigma from the disease, and they can be very scared. And so we really want them to know that they're not alone. So we provide support through the talking with them and the emails, of course, but we also have specialized programs like the Phone Buddy program, which is a one-on-one match by phone that Miranda oversees. We have a monthly gathering, Hope Community Social, that is organized by Michelle, that Miranda also attends. We have online forums through Health Unlocked. We have our original lung cancer forum, and then we now have a small cell specific community, which is great, and Amy oversees that. And then we also, for support beyond what we can offer, we maintain the National Lung Cancer Support Groups, because we know that it's really important for people to be in a community of people like them. And so we not only maintain a list of support groups that people can attend across the country and virtually, but we also help people who are interested to start new support groups. Then, of course, we also maintain a very well curated list of referrals and resources. We don't want people to just be calling a bunch of numbers. We vet the resources and make sure that they're going to be as helpful to people as possible. So that's a real quick overview. In addition, we do have a special focus on small cell that Amy leads. And we also have a great new monthly newsletter called Your Community that Nicole organizes us to get written for. She's a very organized person, and she makes sure we meet our deadlines and gets everything in on time. She also oversees our National Advisory Council. So that's a way that people can give back. We like to make sure that people have an opportunity to do that. And oftentimes people who are matched with a phone buddy also then go on to become phone buddy volunteers.
Thanks, Maureen. That was great. And I just want to give a shout out to both you and Miranda. I mean, I think, especially when I think about the support group network and the list of resources, and I know folks who are familiar with the living room have heard me talk about this before, and I couldn't agree with you more that the emotional support is equally as important as the clinical sort of aspect of support that we provide. And we also know that although there are, general cancer support groups, scattered in fairly large numbers around the country, lung cancer specific support groups are few and far between. So you do yeoman's work in trying to identify where those support groups are, how they are supporting, to your point, whether it's live or virtually, or maybe even on the phone to some extent, but then also helping them create new support groups and or to enhance the support groups they already have. So I think that that in and of itself is a full-time job, let alone the mouthful of other things that you rolled out there. So I want to kind of touch on one other thing similarly to how I did with Jennifer, and that's really the helpline. You know, quite often people aren't really sure what it is they need or what it is they're looking for, merely because they don't know what's available or what's out there. And so when we think about the helpline, or when someone's contacting the helpline, what is it you would like them to know, or we would like them to know?
Yeah, several things. The first that I already mentioned, and that's that we provide a variety of ways to get in contact. People can shoot an email off at 3 a.m. just so that when they're thinking of something, they can call us. A lot of times, the things people ask about are quite in-depth conversations. So, oftentimes we may start out with an email, and then we wind up talking to them because then we can have a more of a quality conversation. So that's the most important thing. It's called the helpline, but it's really a set of services. I think the second thing is that the helpline services are for anyone who is concerned about their risk, going through a process, or diagnosed with lung cancer in their loved ones. So we talk to people all across that spectrum every single day. And there really is no wrong question or wrong reason to reach out. You're right. A lot of times people don't quite know why they're calling, but through talking, we figure it out, and then we figure out how we can help them. I think the third thing to know is that we're very responsive. We understand that it can be hard to reach out for help. And so we really try to answer when people call. Our goal is always to answer live during our open calls. If we can't, we return calls the very same day, unless we receive them after hours or on the weekend. Um, and we also respond to the written request in the same manner. A really important part is just that it's individualized assistance. The three M's answer the helpline. That's me, Maureen, and Michelle, and we understand the importance of listening to hear what the person needs and talking through so that we understand and can provide the most targeted care that we can. And sometimes we talk to a person once or twice, and that's all they need. We have so many people that talk to on a regular basis and have done so for months and years. As their situations change, they reach back out for more help and advice. They might know somebody else who's been diagnosed they want us to contact. So we develop these really strong relationships through that, and then through the LungMATCH referral process as well. And finally, I think it's important to know that we know our limits. We don't give medical advice. We don't tell people what to do. And we always refer back to the healthcare team when somebody needs specific information about their situation.
That's great. Thank you so much, Maureen. I do want to move to next up, and that's Joelle. And we're going to talk a little bit about the programmatic area of healthcare delivery and the role that Joelle and her team play. So, Joelle, can you talk a little bit about your team and give us some examples of the work you all are doing over there?
Yeah, you bet. Thank you. So first, I just want to introduce the 6 great people that work on our team. First, many people know Angela Criswell, who serves as our Director of Quality Screening and Program Initiatives. I'll point out where each of these people concentrate their time and how we sort of cross-collaborate across this department and organizationally as we move through the conversation. But Meg Fay is a recent addition to our team. She's the nurse manager for Excellence in Screening and Care. We were able to recruit Meg from one of our centers of excellence, where she had been up close and personal with patients with lung cancer for over a decade. So really pleased to have her. Another colleague is Robin Mohan. She serves as a specialist in excellence in screening and care. Robin is behind the scenes, but a mighty colleague who shoulders a lot of day-to-day operational work. Makita Porter-Carr is our education manager. She is leading our Global Knowledge Center for Lung Cancer, which we'll talk about. Kathy Levy, who is a project manager and really carries our expertise and is the powerhouse behind equity and community engagement work in our department and across our organization. And then Sarah Weston, who we recently added, who has a number of superpowers and supports us as our special initiatives and project manager. So our vertical, if you will, our department is the Excellence in Healthcare Delivery team. We really aim to improve the 4 key goal areas that Lori Fenton Ambrose shared with you this evening, really by supporting and partnering with our healthcare providers who serve people at risk for lung cancer and who are surviving lung cancer. We accomplish our aims in a number of ways, and I'll share a few of those with you this evening. One really includes a really large effort that certainly predates me, which is our large network of healthcare facilities that are dedicated and committed to quality care. These facilities certainly represent large health systems, but there's a very large conglomerate of community-based facilities across the country that really add up to about 850 facilities or centers of excellence in our network. We provide these facilities, or these COEs, with the latest updates in the field, including scientific and clinical discoveries. We really support them in staying up to date on best practices, clinical guidelines. We really serve as their sounding board and clearinghouse for information, and really as advocates for them in the field, and helping them identify quality care criteria, meeting and exceeding quality standards for their patients. With that, we're about to roll out 10 designations that really kind of cover the continuum of lung cancer, including lung cancer screening, incidental pulmonary nodule, multidisciplinary team, care delivery, smoking cessation, survivorship, community engagement and equity, just to name a few. And so we'll be providing a lot of support in these various areas so that they can do the good work that they are so committed to. We are also very invested in dissemination of knowledge and development of these healthcare providers through education, through a number of pathways. One is through our Centers of Excellence Summit, which is a live event that occurs on an annual basis. This is a 2-day conference where we address a number of current issues. We bring awareness to new information and provide space for our COEs to network and learn from each other. So I think people really count on the knowledge that they get, but also love to connect and build relationships that really power them even outside of that COE summit. We recently added the GO2 Global Knowledge Center for Lung Cancer, and this is really a national and global platform that allows us to provide both synchronous and asynchronous live events that, again, really can house information that is helpful to our community of healthcare providers, disseminate lung cancer information, and really keep them up to date and create a space where they know they can go for free education. We really believe in the value of team-based approaches to achieving our shared goals, and this is really performed through synergizing complementary resources and services across GO2, but also health initiatives with our external partners. And with that, we collaborate closely with others in the field on equity and community engagement, building programs that increase awareness and access to quality lung cancer screening and care, building capacity for research in our stigmatized lung cancer community, and also supporting healthcare providers in discovering the most effective methods for outreach and community engagement. How do we get to our community and drive them towards the quality care that they need? And I would just say that these aims and activities are really kind of just the tip of the iceberg for much of what we do in excellence in healthcare delivery. But it really couldn't happen without our colleagues both at GO2 and outside of GO2. So thanks for your time tonight, Danielle.
Thanks, Joelle. I think it's the work that you and your team are doing is so incredibly important, because we're really working towards providing and delivering access to quality care in the community where people live and where people are being treated. And the community docs and healthcare providers don't have the luxury that maybe some of our academic colleagues and healthcare providers have, where they have the ability of focusing on 1, 2, or maybe 3 different types of cancer. The general oncologist has to figure out and be able to treat whatever walks in the door, whether it's a solid tumor cancer or a blood cancer. And there's give or take 100 different types. And so particularly in a day of precision medicine, it's so important that we as a community band together, partner with one another to help even the healthcare providers have access to the today's relevant information and treatment pathways. And I commend you and your team for the work that you're doing by bringing this exact thing to the people in these communities. So thank you so much for that. We're jumping next into, yes, I do have weaknesses, to one of, and both Elridge and Anita can tell you this. I am continuously challenged by how government affairs, public policy, economics, and health policy work. I know at sort of this really high level, but when it gets down to it, and I've had multiple conversations with both of them trying to explain it to me, and I cannot tell you how much I respect the work that they both do in this very difficult piece of sort of the comprehensive pie of tackling this disease. And with that, I want to jump to Elridge. I want you to introduce yourself and talk a little bit about not only the Voices Summit, which I know is coming up, but also some of the work that you do year round outside of the summit.
Sure. Thank you, Danielle. I'll just start with a greeting. Good evening, everyone. My name is Elridge Proctor. I'm the Senior Director of Government Affairs at GO2. I lead our legislative policy work that includes securing sponsors in Congress to introduce our bills, reestablishing and managing the Congressional Lung Cancer Caucus, submitting and securing annual funding for lung cancer research. And while leading our patient voices and advocacy throughout the year, I do hold and sponsor, and I'm responsible, whatever words you want to use, but I am responsible for planning and executing the annual Lung Cancer Voices Summit, which is a conference for the patient community. I'm happy to talk to you about our government affairs work, but I think it's important for you to hear who is it that we give a voice to. So we represent not only those who are battling lung cancer, but those that are supporting the loved ones, those who live with and care for someone with the disease, and also those who are at risk, including women, veterans, active military men and women, as well as those who are underserved and underrepresented in lung cancer. In government affairs, we address a number of federal policy issues that can range from Affordable Care Act coverage of preventive services and treatments, 21st Century Cures Act that included Cancer Moonshot, research funding, among so many other access to care issues. But our focus is on specific policies that we've established and are leading that are specific to the lung cancer community we at GO2 represent. Lung cancer research funding is one of our highest priority issues. Our advocacy for research stems from the fact that, and you all know this, that lung cancer is the #1 cancer killer, but receives the least federal funding per death of any cancer. So one of GO2's most significant achievements has been establishing the lung cancer research program within the congressionally directed medical research programs administered by the Department of Defense. While this program is for the military population, the research greatly benefits the military and the civilians, thus allowing us to serve both populations. And also, because annual appropriations are required to maintain this lung cancer research program, GO2's work leads the submission of this every year through the Congressional Lung Cancer Caucus that I mentioned, which is established in the House of Representatives. And through the network of our passionate group of survivors and caregivers, we advocate with one voice for increased lung cancer research funding every year. This year, our goal is to secure the requested $60 million for the lung cancer research program. Our second lung cancer specific issue deals with the fact that we saw a rise in the number of young women with lung cancer who never smoked. And so to answer this question, we secured leaders in Congress to introduce the bill known as the Women in Lung Cancer Research and Preventive Services Act. The bill has 3 main provisions, which is to increase research in women and lung cancer, improve access to preventive services, develop a national public awareness and education campaign. And of course, we had hoped that the legislation would pass last year and didn't. And so we have secured assurance from our sponsors that they will work with us to reintroduce the bill in this new Congress. And so I mentioned these two issues because as they are renewed and are pending before our Congress, we will need this community support again. And one of the best ways to join us and to have your voices heard is at our annual Lung Cancer Voices Summit. It's really the only meeting that brings the lung cancer community together for all of the power action that we can take. That's education, that's training. It empowers you as the individual to become advocates, and it puts you in direct advocacy action with your members of Congress. And so this year we will be launching registration actually tomorrow for this Voices Summit. Registration will be open from January 18th through February 26th. And we invite everyone in the lung cancer community and anyone interested in advocacy to join us and have their voices heard. Again, GO2 is eager to partner with you and to represent your voice.
Thanks, Joel. I think that was a fantastic summary of the work that you do. And I think it points back to a lot of the work that PSS has been doing with you to sort of get to this place and really try to understand how we get to an even better place where folks whose voices we're sort of calling for will come to the table, right? And to use a way overused sort of, little quote is that it takes a village, but in this case, it really, really does. There is power behind banding together, generating this community, and using our voices to ultimately affect change. And you are absolutely right that our summit is a fantastic place to do that. So we are here, we are open to the conversation. If you want to learn more about how to activate and get involved in this area, please, please, please reach out to us, and we will point you in the right direction of gathering more information around this.
I just want to add on, I think it's also a nice example of how a lot of our programs really touch each other, because not only are we looking at some of these issues from a policy standpoint, then we also have research studies that are looking at the same issues. So we have an epidemiology of young lung cancer study to look at why are young people diagnosed under the age of 50 getting lung cancer, and that work parallels the work that Elridge and everybody's voices along with her are doing on the Hill. And so it's just one great example of how all the people on this call are really integrating our work to try to move key priorities forward.
Yeah, thank you, Jennifer. Such an important point. And I think, I remember my first time on the Hill, which was several years ago. I actually had anxiety about it, right? Like going in and speaking to our lawmakers and our legislators, thinking, well, what do they care what I have to say? And trust me when I say they care. They really, really do. So if it's something you think you might be interested in, the folks on this call will all be there, as well as many other people from GO2, but also people from your community from around the country. So the opportunity is not just to talk to your legislators and be up on the Hill, managing that aspect of it, but it's also really about connecting with other community members that, like I said, come from all corners of the country. So with that, I am going to turn to Anita. Anita is our Senior Director of Economics and Health Policy. And Anita, same question goes to you. Tell us a little bit about yourself and about the work that you're doing at GO2.
Yeah, thanks for the introduction and thanks for having me. I'm Anita McLaughlin. I'm Senior Director of Economics and Health Policy at GO2. Excited to share with you a little bit about what our departmental work focused. I'm going to kind of put a spotlight on screening because it has such a big impact on the lung cancer community, but also just kind of give you a quick overview of policy in general. And you'll kind of be able to also connect the dots when I go into a little bit of information about how my department works cross-departmentally with some of these other folks here on this panel. So we have a wide range of functions in support of the GO2 for Lung Cancer's mission in advancing lung cancer survivorship. My department looks at how to support those goals through policy pathways. And as I mentioned before, I'm going to be focusing on screening, but particularly around coverage and reimbursement. I also wanted to give you a little bit about what can happen between coverage and reimbursement before, during, and after. I'm sure you've heard of the activities through government affairs on federal and state legislation. There's science and research, Jennifer's team, and evidence development. There's FDA approval processes in place, practice guidelines and standards on how to standard of care and performance of the procedure. There's claims and insurance and coding and billing. And so that's kind of more the area that I'm going to put a spotlight on, again, around coverage and reimbursement. There's rulemaking processes through federal agencies, and then there's implementation itself. So there's a lot there. Reimbursement, coverage, these are key drivers of patient access and uptake. Coverage and reimbursement, it impacts patients and providers, and it's really difficult to navigate between commercial insurance, Medicare, Medicare Advantage, and Medicaid programs. There's a lot of variables within that pot. When we think about patient barriers or patient access issues, there's a lot to unpack. We at GO2, we often hear about out-of-pocket costs and copays, surprise billing, and financial toxicities. There's lack of provider and patient education. We also hear about a lot of insurance limitations and coverage criteria that differ. This is happening both locally and nationally. There's lots of complexities around coding and billing requirements. Again, they can differ between plans. There's prior authorization hangups, timeliness issues, or potentially just like flat out denials of tests. So, I mention all this because it's really confusing. It causes a lot of access hangups and barriers within patients and also healthcare providers. At GO2 for lung cancer, we look through the lens of our mission statement to increase survivorship. This is in driving advocacy, again, through policy pathways. So this might include coverage policies. So you're familiar with your insurance plans there at home. Those on Medicare, there might be different coverage policies between commercial plans and Medicare. And as I mentioned before, there's a lot of complexities around coding and reimbursement. We also address payer relations issues. So commercial payer side, there's regulatory affairs, which has to do with a lot of the federal agencies. And there's, always that patient advocacy with a focus on health equity, quality, and patient access. Earlier I was mentioning that I would be putting a spotlight on screening. That's one of the most impactful policies in place. It's with low-dose CT, lung cancer screening, which is essentially a picture or a scan of your lungs. This is currently the only proven test for early detection of lung cancer. And I'm pleased to share that there's been national coverage in place since 2013 by commercial payers, or most commercial payers. And Medicare followed suit with coverage in 2015. There's been more recent activity that we've been involved with, the 2021 expanded criteria by the United States Preventive Services Task Force. And again, that was followed by an update and expanded criteria by Medicare in 2022, so just this past year, for national screening coverage criteria. And this expansion of the criteria nearly doubled the screening eligible population. They essentially started the age at a lower start age, so beginning at age 50 for screening versus 55. And they also lowered the smoking history calculation, or the amount of smoking required in your history, from 30 pack years to 20. Individuals who are meeting the high-risk criteria, low-dose CT screening for lung cancer, it's covered by Medicare and most private insurance plans at 100%. With zero out-of-pocket costs. And this would be just like mammograms or other screening tests that you go in for. There's some research to support that screening people who may be younger or who've smoked less, or who have other health conditions, that increases the risk of lung cancer, like diagnosis of COPD, a family history of lung cancer, or job exposure to cancer-causing agents like radon and asbestos. We've recommended that folks talk with their doctor to find out if low-dose CT scan is right for them. I should mention that low-dose CT for other risk factors that fall outside the screening criteria, they may have out-of-pocket costs. And this is an area where advocacy work continues, that my department also is working on we believe screening criteria should be expanded and mirror the National Comprehensive Cancer Network practice guidelines. We also continue to advocate for insurance coverage with no cost sharing of lung cancer screening by all payers, including Medicare and Medicaid, and also private insurers. I wanted to point you to the American College of Radiology. They maintain a document that shows those commercial payers that have updated their policies based it on the expanded screening criteria. I looked it up today. It looks like it was updated as of December 2022. This can be found on the acr.org website, and it is titled Status of Lung Cancer Screening Coverage. Included on the ACR page is also a template letter that we were involved with. It can be used by patients and providers who'd like to advocate for screening coverage. The GO2 Foundation, we've worked closely with the ACR and the Society of Thoracic Surgeons for, over a decade, and since the inaugural coverage of low-dose CT lung cancer screening, and we'll continue to work with key stakeholders in advocating for our lung cancer community. I wanted to mention that the magic, it happens when everyone's North Star is lung cancer survivorship, and we can do this through early detection, annual adherence to screening and treatment care. I'm honored to be a part of this panel and GO2 for the lung cancer community, where our North Star is doubling down on survivorship, which is pretty cool stuff. Thank you.
Thanks, Anita. That was a great recap. You guys are probably seeing me like smile ear to ear throughout this whole thing. Every time I hear about it, I myself get goosebumps, and I'm so proud of the work that everybody's doing. And it just, having us all here talking about this tonight just is really re-energizing for me. And I think, the work that you're doing, Anita, particularly around coverage and reimbursement, is really in hopes of ultimately eliminating this pain point for patients. It's hard enough to get a diagnosis and then to find out you cannot get covered for the treatments that are being, either brought to you and or for potential diagnostic to find your disease early. So thank you so much for the work that you do. Jennifer, I want to talk a little bit about the work that you do, particularly from a community engagement standpoint. I know there's a fundraising element to the work that you do, but give us a little bit of a background on you and your team.
Hi, I'm Jennifer Hughes. I'm the Senior Director of National Events. We go out into the community and are able to really, introduce all these programs to everyone that doesn't know us yet. Or on the other end of it, people that are involved with LungMATCH or the living room or, the HelpLine, they, like to come to events and continue their relationship with GO2. Our big goal this year is to really get back out into the community and be able to be in person again, because we find, engaging with patients, their families is so important, especially even in the hospitals, to get everyone back into getting in through the communities and growing our community and having a safe space, as well as raising awareness about lung cancer. We also do raise funds in several different ways, but awareness is a big piece of what we're out there doing. On our team, we have Katie Morello. She is the manager of events operations. She does the Shine a Light program, which is a free program that we raise awareness through every November through the healthcare facilities nationwide and even international to raise awareness and educate about advancements in lung cancer. It is a huge program. We've grown it, especially over the past 3 years, which we've been virtual, over all 50 states. We have 226 Shine a Lights, as well as 2 countries, Ireland and Italy. If you have any questions about this program, please reach out to Katie Moe. It's an amazing program to be a part of. We also have Jackie, who is a regional events manager. She is new to the team. We have our first 2023 in-person event in Hollywood, Florida. We're very excited. It's on February 11th. She will also be managing the Houston, Texas 5K, which will be September 20th. And also we have a virtual, still one virtual event that will do outreach to all the communities that don't have in-person events at this time. And that's Summer Jam, which will be on June 17th. And also Philadelphia, September 30th. And she's also managing our endurance program. So all endurance, runners can join a team and raise money and awareness for lung cancer, we are part of the New York Marathon, which is a huge platform to be a part of through the community. Bridget Perchatsky is our Associate Director of National Events. She manages this whole team for the 5Ks, the grassroots events. If anyone wants to start an event for a loved one in honor of one or memory of a person, we're happy to assist anyone on that. We're also in the process of hiring another counterpart for the West Coast events, which are the Sacramento 5K, April 1st, San Francisco 5K at September 23rd, and our Southern California on October 14th. All of our events, we plan on being in person this year, which we find extremely important. I know we're all missing it. We did a couple in-person events last year. It was so nostalgic to be around people and it's so important. And and hopefully the living room will be back in person as well to be a part of that. We also have signature events, which is the golf tournaments, which is in Millbrae, California, is also the Simply the Best Gala on November 11th at the Fairmont in San Francisco. And all, people with lung cancer are come to that event for free. And it is an amazing event to be able to, meet physicians and the GO2 team. So that is really what we have in a nutshell.
I think that's great, Jen. And I want to sort of reiterate first I want to make a comment. One is, if you haven't been to a GO2 event that is put on by Jennifer and her team, I highly recommend it. They are an amazing time. And really, like what I'm hearing a lot about lately, you've been hearing a lot about it. You touched on it. I think, Elridge, we touched on a little bit around the Voices Summit, and we touched about it in a couple of other places. It's really about getting back together, right? And I think you said it, Jennifer, like people are missing the connectivity, right? And I think, when we look at, since GO2 has been GO2, I mean, for 3 of the 4 years of that, people have been in isolation, right? And we are here not only to tell you today, about all of the great work that is happening across this organization, but that we are ready to roll up their sleeves and get back out there and help, to kind of connect the community back together again through all of these various ways. We hear you. We know it's important. Jennifer already told you, we're going back live with events. Elridge, talked about the Voices Summit that's coming up in March. We're going to be back live in person. The living room will be going back live in person with live speakers in April. So we're hitting the ground running this year, and I hope that's something that's resonating across the board. I do want to give Lori Fenton Ambrose an opportunity to maybe, close us out with any take-home points or any thoughts about the great work that I know we're all doing.
And Danielle, thank you. And to all of you who are here tonight, and to the rest of the team that I know is watching, but also there, we have your back. That is really what it's all about. Our organization was founded by patients and survivors. That's all we do, is think about our community's needs. It is what we are dedicated to being and to serving. We are here to serve the lung cancer community in only the way we can. And as you saw tonight, everything we do connects. No scientific breakthrough is worth its weight unless it can get to people where they need it most, affording it and with high quality. So our work is to make sure that we're moving to advance the earlier detection and the treatments that will extend life and allow you to elevate your voice and keep that circle of hope and transformation going. And we just stand proudly with you, are grateful for the support and the trust and the faith that you put in us, because you are what motivates and inspires us every single day to do what we do. So I say thank you, not just to the team, but to our community that stands along with us to transform survivorship. So thank you.
Thank you, Lori. And before I sort of close out this meeting, I just say, we heard a lot, or a little bit, about a lot of work that GO2 is doing around engagement and equity. And I hope that you take away, and please reach out if you want more information about, but you really take away the work that we are doing, the hard work that we are doing, really comprehensively, A to Z across the board, to equalize information and access for people at risk and for people diagnosed with lung cancer. I mean, I can tell you, I've never worked with a more committed and dedicated group of people who really, at the heart of it, are in it. I mean, we are in it. And I love the team that I work with. GO2 is my family, and GO2 is my home. And I hope that you all will continue to engage with us in even bigger and better ways. And I hope that we are, not I hope, I know we will be able to deliver on whatever it is that the need is. So thank you all very much. As always, for those of you watching live or those of you who are watching post live, to get regular updates on this programming, as well as information on other GO2 Foundation patient programs and services, please join our patient and caregiver community. The URL's there on the bottom, but it's really easy to find if you just go to the living room page on our website and click the big green button that says join the community. We'll get you right in. We'll be able to give you updates and relevant information as it comes to be. I want to give a huge thank you and shout out to our panelists, to the entire GO2 team, for all of the tireless work that you do for our community. To all of you, of course, watching live or post live, Penn Media, who's sort of in the shadows in the back behind the scenes here, making it possible for us to bring you this programming. And of course, our generous supporters, Amgen, AstraZeneca, Bristol Myers Squibb, Daiichi Sankyo, Foundation Medicine, Genentech, Merck, Mirati, Novartis, Regeneron, Sanofi, and Takeda. Thank you for supporting the good work that you and we know we're doing. Until then, we will speak, or we'll see you all in February. Thanks, guys. See you soon.
So I'll be brave if you're brave. I'll be brave, but only if you're